Have you ever asked yourself, maybe late at night, is it still okay that I do this every day? Not out of guilt, not out of shame, just a quiet question that lingers in the back of your mind. If you're over 60 and wondering about masturbation and your prostate, you're not alone. Men will openly talk about cholesterol, blood pressure, even testosterone. But when it comes to self-touch, silence, hesitation, confusion. So let's break that silence today. Let's answer the question, what actually happens to your prostate if you masturbate daily after 60? Is it harming you quietly or protecting you in ways no one has explained before? Stay with me, because what I'm about to share may change the way you look at your health and your body for the rest of your life. Before we dive in, do me a quick favor. Hit the like button, subscribe if you haven't already, and drop a comment telling me where you're watching from. I love knowing where my community of men is tuning in from around the world. For decades, men have been told all kinds of things about masturbation. It drains your energy. It causes prostate inflammation. It could even cause cancer. But here's the truth. Most of these beliefs are based on fear, not facts. And when fear replaces science, men stop asking the right questions. They suppress their biology, and worse, they might avoid something that could actually protect their health. The good news? We don't have to guess anymore. Medical science has studied this, and what it shows is surprising, even shocking, to many men. I'm Dr. Sophia. I've been working with men's health for over 10 years, helping thousands of men over 50 and 60 restore confidence, energy, and vitality. So today, I want to walk you through what real medical science says about daily ejaculation, prostate health, and aging. We'll cover the biological mechanisms, why your prostate responds the way it does, the mistakes men make that can backfire, the simple natural habits that protect your prostate long term. And I'll do it the way I do with my patients. No judgment, no taboo, just clarity. Reason number one, clearing the pipes. Your prostate is a gland, its job to produce seminal fluid. When you don't ejaculate for long stretches, those secretions can build up inside the gland. Think of it like a garden hose left unused for weeks. Water stagnates, debris collects, pressure builds. Inside your body, stagnant fluid increases oxidative stress and creates a breeding ground for inflammation. Regular ejaculation? It's like flushing the system, keeping things clean, balanced, and flowing. Reason number two, lowering inflammation and stress hormones. Here's something fascinating. Ejaculation, especially when it happens in a relaxed state, reduces cortisol, the stress hormone. Why does that matter after 60? Because elevated cortisol is linked to chronic inflammation, high blood pressure, poor immune function. So in a very real way, that private moment may actually be lowering your inflammation levels and helping your prostate avoid unnecessary irritation. Reason number three, supporting blood flow and nerve health. Just like muscles need activity to stay strong, your reproductive system needs stimulation to stay responsive. As we age, blood flow decreases everywhere, including the pelvis. This can lead to poor nerve signaling, weaker circulation, and eventually prostate dysfunction. Ejaculation helps maintain healthy blood flow in that region. It keeps those pelvic nerves firing. It reminds your body, this system is still alive. Keep it working. But here's the catch. It's not just about frequency, it's about context. The large Harvard study published in 2016, one of the most trusted studies on prostate cancer risk, followed over 31,000 men for nearly 20 years. And what did they find? Men who ejaculated 21 times a month or more had a 33% lower risk of developing prostate cancer compared to men who only did 4 to 7 times per month. But here's the detail most people miss. These men didn't just ejaculate often, they also lived healthier overall. They exercised, slept better, ate better, and managed stress. So the lesson is, masturbation isn't a magic bullet. It works best as part of a healthy lifestyle. Let's break this into a daily action plan, because if you're ejaculating regularly but eating processed foods, sitting all day, and barely sleeping, you won't get the benefits. Here are the 5 habits I teach my patients. 1. Nutrition that calms the prostate. Your prostate is highly sensitive to diet. Lycopene in tomatoes, watermelon, pink grapefruit reduces oxidative stress in prostate tissue. Green tea with EGCG lowers inflammation. Omega-3s in salmon and sardines protect against chronic swelling. Cruciferous veggies like broccoli support hormone balance. Imagine this. Every time you put tomato paste on whole grain pasta or enjoy watermelon, you're literally feeding your prostate protection. 2. Daily movement equals circulation. Sitting all day with poor posture cuts pelvic blood flow dramatically. That means stagnation in the prostate. But when you walk, stretch, or even do pelvic floor Kegel-style exercises, you boost circulation and strengthen urinary control. And yes, this same circulation supports healthy ejaculation. 3. Sleep equals hormone reset. Testosterone, the hormone that drives vitality, peaks during deep sleep. Poor sleep equals lower testosterone equals higher risk of prostate problems. Tips: cut screens 90 minutes before bed. Keep your room cool and dark. Try magnesium glycinate or tart cherry juice for natural support. Better sleep means better hormone balance and a calmer prostate. 4. Fighting inflammation, the silent enemy. Chronic prostate inflammation, prostatitis, doesn't always come from infection. It often comes from lifestyle, poor diet, high stress, alcohol, smoking. Studies show anti-inflammatory diets plus stress reduction can improve prostate symptoms better than some medications. And yes, ejaculation plays a role in lowering inflammation, but only if the rest of your lifestyle isn't constantly fueling the fire. 5. Releasing shame and stress. This may be the most important. Many men carry silent shame around masturbation from upbringing, religion, or society. But guilt is more harmful than the act itself. Why? Because shame raises cortisol, lowers immunity, and creates emotional stress that weighs on your entire body. Your body isn't broken. You're not too old. This is a natural biological function. When you let go of shame and approach it mindfully, it becomes part of healing, not a source of stress. Now, maybe you're wondering, I'm 65. Does this still apply to me? Yes. Your age doesn't erase your biology. In fact, as you get older, your prostate needs support even more for circulation, nerve response, and hormonal rhythm. What changes is how you approach it. Less rush, more mindfulness. Gentle, not forced. Think of it like exercise. At 25, you can sprint. At 65, you walk, stretch, and strengthen. And you still get massive benefits. So let's bring this home. Masturbation is not a shameful leftover from your youth. It's a natural function, one your prostate may depend on more than you realize. Done regularly, gently, and without guilt, it may help reduce inflammation, flush harmful buildup, support blood flow, maintain nerve health, and even lower your long-term cancer risk. But remember, it's only one piece of the puzzle. Diet, sleep, movement, mindset, and stress management all matter. If this helped you, hit the like button, subscribe for more men's health insights, and share this with a friend who might need to hear it. And if you're ready for the next step, watch my video on daily habits that protect the prostate after 60. It's the perfect follow-up. Simple, practical, and life-changing. Gentlemen, age is not the end of vitality. With the right choices, you can protect your prostate, preserve your dignity, and reclaim freedom and confidence in your own body. You've got this. Dr. Sophia.